Okay.
Oh,
Okay, it's recording. Do you see that in the corner?
yeah, I see it.
Okay. Okay. I'm gonna
Okay.
introduce myself, and then you're gonna introduce yourself, okay?
Okay.
Hi, I'm Arista. I wrote a paper on symptoms, treatment, and stigma in borderline personality disorder, and this is part of my outreach project for clinical psychology. Now, will our esteemed guest please introduce themselves?
Hi, I'm Des. Yeah, I don't know what else to say.
You
What do I
what
say?
what's the reason you're here, Des?
Oh, I have BPD diagnosed, and
Woo!
yeah, we're gonna talk about it.
We're gonna talk about it.
Yeah.
So I know we both reviewed my research paper a few days ago, which was when we wanted to get on call, but that has been difficult for us in recent times. But we're here now, which is incredible. Um, I guess I would want to start with asking you, like, was there anything in my paper that you may or may not remember, that you may remember, that might have like stood out to you and something that you wanted to like maybe personally comment on? If not, it's fine. I can start talking.
Um. mhm. Hold on. I don't know. I just like that the whole entire paper like specifies like the stigma around people that have been diagnosed with BPD and how hard it is to get a diagnosis and get treated for it, and that like people look at us differently because we have a diagnosis that people automatically assume is like we're crazy.
Yeah, I right? Can you move your mic a little closer to your mouth? It sounds like you're speaking through a pillow.
Okay, hold on. Is that better?
Perfect. Thank you. Okay, keep it that way. Yeah,
Okay.
so I would also like to add, like, I've had personal experiences. I have met a strange amount of people in my life with BPD. Like, I'm going on like 7 right now. Crazy. I know we were talking about this last night, and you were like, "That's wild. I've met one other person." But I've had, when I was younger, I had a lot of like really negative experiences with people with BPD, and I was like, "Oh, everyone with BPD is bad. I should stay away from them. Bad diagnosis." And then I met you, and I was like, "Wow, so that's actually not true." I guess like the thing that I kind of like to bring up is like there's good and bad people with BPD, just like there's good and bad people in literally every other demographic of people. I mean, okay, also, I know that you were talking, I wrote a lot in my paper about how you mentioned how it's really difficult to get treatment. And I know we've talked briefly about like your experiences with getting treatment. What was that like for you?
Um, what? Sorry, I'm so unserious, guys. My bad.
It's okay, it's okay, it's okay. We're chilling.
Well, originally, originally around like middle school is when I started to like just like be weird overall, and like like it was already like a struggle enough to get like, hey parents, I'm like struggling, because you don't want to go and tell your parents that they're gonna get scared, but
Right.
once I did end up getting into a doctor, it was very like difficult to like voice exactly how I felt and why I was feeling it, because like, I'm in middle school, I don't like know anything. And
Right.
like obviously I know what like depression and anxiety is, because, all that stuff. And so doctor like my doctor and my therapist is like, "Oh, you just sound like you have just like, stereotypical anxiety and like clinical depression, and you just it'll get better."
When did you actually get your diagnosis? Like, how old were you?
Sophomore year. How old are you in sophomore year? It was beginning of
Um,
sophomore year.
wait, how old was I? Wait.
15, 16.
Yes, that's the age you're supposed to be in sophomore year.
Yeah.
Okay. So, because also I wanted to ask, like, I know I mentioned in my paper about how BPD is like generally considered a diagnosis that you can't give to children or like younger people or adolescents. How do you, I know that, okay, I guess what I'm trying to say is like, what do you think about that? Like, do you think that should be a thing that is upheld?
Wait. Hold on, say it again.
Okay, no problem. So, BPD is, I phrased it very strangely. I don't know why I did that. What I was trying to say was that BPD is considered a diagnosis that you can't give to children. How, do you think that should remain a thing?
Well, it definitely depends between like every single individual because I mean like the other person that I met with BPD started showing signs of like you know like almost like bipolar symptoms before they were diagnosed. And that started like we knew each other since we were in elementary school, and that started when we were like in third grade when she was like 8. And that's because like I feel like it definitely becomes more prominent when uh it's like pretty like boldly laid out that like let's say let's say like a child had like really bad trauma in the beginning of their life. I
Mhm.
feel like they're more likely to like exhibit BPD symptoms
This is true.
more,
It is, yeah.
yeah, like more broadly.
It is
So
in
I feel like
fact like BPD is linked to other trauma disorders, not other trauma disorders. BPD is linked to trauma disorders like PTSD. They're often comorbid.
yeah. Whereas like for me specifically, I think the reason why my diagnosis was so difficult was because I didn't really have like very outward symptoms of it.
Mhm.
It was very much just like subtle little things that people are like, "Hey, that's it's not that normal."
Do you have any like perhaps some examples for us?
Um, well, in middle school, what would happen is like, like I was very, I was very like back and forth. Like bipolar was one thing that was brought up a lot when I was like that age because they're like
Mhm.
maybe you're just like bipolar because I would go a lot of back and forth, but it wasn't like I would go from happy to like sad really quickly. It was more of like a um I don't know how to explain it. I would go from like, oh, I'm really happy with my life and I'm gonna succeed and do everything. And then the next like few minutes I'd be like, wow, I'm literally gonna die alone.
So there would be like really like rapid mood swings, like you would
Yeah.
say. Yeah.
Yeah, and it wouldn't be like
Yeah.
a stereotypical like, oh, I feel sad right now
I
or
do
oh
think
I'm happy.
sorry. I do think
Like,
it's really interesting thinking about like what disorders kind of overlap with BPD because I think people are really hesitant to talk about that. Like I have autism. I have autism, and I've noticed through talking with you that a lot of like our symptoms overlap, and I think that's also definitely the case for bipolar disorder, but I think people are super hesitant to be like, oh, these are also common symptoms in BPD because people just like really don't like BPD as a diagnosis. I know mentioned in my paper that sometimes doctors will withhold diagnosis from you, which I think is crazy because how are you supposed to get treatment if you don't have a freaking diagnosis? That's crazy to me.
yeah.
Like, yeah, and also like I guess like I wanted to say like I know we've talked about like having intense interests in people, and that's something that overlaps with autism and BPD because you can have like a special interest in a person or other kind of like mood swing related things. Do you remember anything else we talked about that when we were having that conversation?
Um,
Oh,
no, I don't
and
regret this.
de delusions, right? That's something that overlaps in BPD and OCD, and I have OCD.
Oh yeah. Yeah.
Which I think that I think that it's pretty important to make it known that symptoms of BPD are not just in BPD, they're in other disorders as well. So, why would we hate on BPD specifically, but we're like, oh, people with OCD are fine. Like you don't like really see the same level of stigma in like OCD as you do in BPD, but some of those symptoms overlap.
I feel like when people hear borderline personality disorder, they automatically go, "Oh, that person's kind of like psychotic." Like
Hmm.
they I feel like a lot of the time from like what I've experienced, I feel like a lot of the time when I say I have BPD, a lot of people are like, "What's that?" I tell them and they like automatically think like and I kind of like explain it to them and they automatically think I'm like schizophrenic.
Yeah, I think, and I also think that there's when I think about like the most stigmatized disorders, like I think of BPD and then I also think of schizophrenia because like I think a lot of people when they hear like psychosis or like anything schizophrenia related, they're like, "Oh, that person's crazy. They're
Yeah.
gonna they're gonna harm others. They're like a danger to society. They shouldn't." be integrated into it, stuff like that. I think that kind of like attitude is also similar towards people with BPD.
Yeah.
I think when I first met you and when you mentioned you had BPD, my initial reaction was like, ugh. But then I was like, I talked to you more and I was like, oh, well, this is like, they're just like chill. Why did I think that? Like, it wasn't like you did anything that made me like be averse to you. I just heard the diagnosis and I was like, oh, that's not good, which in hindsight was very not cool of me. Not my opinion anymore, I promise.
Yeah. It like I feel like it's very like common like when people are like, "Ugh, oh, okay."
Okay.
I've gotten used to it because that's everybody's reaction. And then the people who like are like, "Okay, well, you're like kind of a freak because you have because you have BPD," but then they still like decide like, "Hey, maybe you're okay." Are the people who actually start to understand like, "Hey, they aren't all that bad," because I feel
Yeah.
like it's like definitely a big thing with it. It goes for any like mental disorder or any sort of disorder. It goes a lot for like just like how people like cope with it because again there are some people who are bad and there are some people that are good and a lot better
Mhm.
at like I wouldn't say hiding it, but just kind of like controlling their emotions
Yeah,
to
'cause yeah,
function.
I know you I don't know if this is still accurate, but last we talked about this, I recall that you are currently unmedicated. Is that still the case?
Yes, indeed.
What has that like been like? Like, I guess I'm just asking about your like history in general. Share as much as you want to be out
Yeah.
there.
Um. Well, so originally I was on like antidepressants and antipsychosis
Mhm.
medicine, and
Classic.
honestly, I mean, I would say it helped a little bit, but at the same time, I feel like it kind of just made me more dull. Like I like
Hmm.
honestly, it kind of made me have like less motivation than before. I was a
Interesting.
little less like looped or out in the head, but like at what cost?
Right.
Um, then being taken off of meds, I feel like it's definitely like at first you kind of have to like really like get used to it because like when I first was off of my medication, I was kind of like really like zoned out and like I didn't really I wasn't very like social really
Hmm.
because that's like whatever I have like episodes or like anything that like or, like I like get like really like dodgy and like suspicious of everybody.
Hmm.
And I feel like when I first got off of my medicine, it was really bad. But like the more I socialize and like the more I kind of be like, okay, like take a breath. People aren't trying to like kill you. Then I feel like it's been pretty good. I mean, I've been off my meds for like 5
Been
or
a
6
while
months
now.
now.
Yeah.
So
Which is, and it's super interesting because I remember when you first went off your meds, and like again, my initial reaction to that was like, ugh, because you don't hear about people who have BPD that aren't on meds. Like it's assumed that there will be pharmacological intervention to manage symptoms. So my immediate thought was, oh, that's not good. But I didn't. I know you said that like at first socializing was kind of different and harder, but I didn't really notice any of that in you, which also kind of made me think, oh, I'm uneducated. There are other treatments that I'm not aware of. I think that people kind of overlook the value of non-pharmacological treatment with BPD. It's interesting
yeah,
because also I think that's a thing with ADHD because ADHD is like the one disorder, or I'm sure there are others, but it's the one disorder I can think of where the immediate thought is, oh, let's put you on meds. Like that's the first option where usually that's like a second or a third with other disorders.
yeah.
I had a thought a minute ago and I know you've talked about like your history with selective mutism, which is really interesting to me. Is that like related to the BPD for you?
Um, yeah, actually, yeah, because it's kind of so it started before middle school, but it was kind of like a we don't know why she does this. And eventually it kind of like pieced together with me and my therapist and my psychiatrist. We were all just like, actually it like kind of conforms to BPD because I would stop talking and I just like I wouldn't want to talk because a lot of the time, if I'm really quiet, it's because I feel like if I talk, like it's like a fear of I'm gonna say the wrong thing, a fear of judgment, and
Hmm.
like just overall, just like paranoia around like I don't know the way I talk. Like
Hmm.
I could say hi, and I'm like, did I say hi in a way that'll offend someone? Do I sound mean?
It's that and that totally happens with other disorders. Like for sure with autism, that's a thing. Sometimes I say something in a certain way and I'm like, "Oh wow, they totally misinterpreted that. They hate me. Why did I say it like that?" Even like and it's not even that deep, but it's just it feels like that sometimes. Like
Yeah.
and I think that that's another thing that I know that it sounds like when you talk about your symptoms a lot of the time, it seems like they're pretty internalized. Would you say that's true?
Yes, definitely.
Which is because I think that a lot of the even when I was writing my research paper, I noticed that a lot of the research talked about externalized symptoms of BPD, like high impulsivity, like difficulty managing anger. And I know that's something that you've talked about as well, but
Oh yeah.
you have, to my understanding, you have a pretty solid grip on that sort of thing.
Yeah, I like there's some days where I'm like someone will just like look at me. I'm just like, maybe we should fight.
You're so real for that. And also, again, another symptom that overlaps with BPD and autism is anger management issues, which is something I struggled with as a kid too. I just, you grow
Yeah.
up, you usually get a better handle on that sort of thing. But
Yeah.
yeah, totally. But I think that it talks about a lot about like how the disorder might be externalized and how other people might like see the symptom, which I think is probably a marker that a lot of the people who wrote these research papers probably did not have BPD because I think you would agree that it's a pretty solid research paper, right?
Yes.
But I think that it kind of shows that people with BPD are not generally in psych fields and don't really get their voices out there because I think it kind of doesn't really show a deep understanding on the internal aspects of BPD, which I think are probably overlooked a lot because those aren't the parts that you see. And it's a thing with autism too, where even like in early autism research, the assumption was that people with autism just don't feel empathy at all. Whereas later, especially when autistic researchers were put on it, they were like, that's actually not true. It's just easier for autistic people to communicate with other autistic people, you know?
Yeah.
It's, I think I mean, I definitely think we need more researchers with BPD. Actually, oh, this was another thing I wanted to talk about. I know when I was writing my paper, I was texting you and I was like, wow, you guys got a whole kind of therapy made for you, because that's what dialectical behavioral therapy is. And you were like, I did not know that. And
I
it
couldn't.
actually turns out that the person who created the therapy, as I later learned in class, has BPD, and she didn't even let people know about that until way later because she was like, I don't know how people are going to react to this information on me because it's still so stigmatized. Even though she literally like created the whole thing, she still didn't feel comfortable talking about it. And I think that I just think that sucks. I don't know. So you hadn't heard about DBT at all before I mentioned it?
Nope.
Huh. That's kind of crazy. Have you like been in therapy for BPD?
Not specifically for BPD, but
Oh,
I've
okay.
been in therapy.
That's probably
Um,
why you haven't heard about it.
yeah, I was about to say I'm like low key like too scared to like go to that like an actual like therapy session specifically for BPD.
Why is that?
I think it's just I don't know. I actually have no clue. I don't know. It's just like a really like weird fear about it. I think it's because I think it's because BPD is so like okay, so like it's always stigmatized, and so like just like growing up, now it's not as bad, but like before, in like recent years, it's been like almost embarrassing to have the
Hmm.
diagnosis because like you think sometimes you're like, wow, I'm not normal. Like my brain doesn't function like another
Hmm.
person's does, and like a lot of people like don't understand me. But then like I don't know. But then I've met people like you and like other people who just like go through pretty similar things without even having like BPD. You just have like symptoms that like overlap with
Right.
it.
I've called it the I have the OCD autism combo of like the Walmart BPD experience.
Exactly.
Like I have a lot. I was shocked to find out that there was so much overlap because I was like, oh, BPD is like this whole thing that it's nothing like anything that I have. No, it totally is. I have a friend with autism who got misdiagnosed with narcissistic personality disorder, which is another cluster B personality disorder that's pretty similar to BPD in some symptoms that is also like very highly stigmatized.
Yeah.
But I guess what you were saying kind of relates to the stuff that I was talking about in my paper, where like it's because of the stigma, it's so hard to even think about seeking treatment because you're like, oh, I don't want to, there's something wrong with me. I don't want to, maybe I don't want to deal with that, or it's just kind of scary to admit that and like actually go to get help because everyone like hates people with BPD.
Yeah. Yeah, I don't yeah, it's just like a um
When you were getting on medication, did you have that same kind of feeling?
yeah, but it was kind of like a for okay, for the start of it, it was kind of like a you have no choice. You
Hmm.
have to go on medication. So it took a lot of fighting to actually get off of it. It was a very like you have to be on medication or you
Really?
can't like function as a human.
Really? Can you elaborate on that?
Well, originally my doctor was like everybody who has oh, my lights just flickered. Anyways, my doctor was like everybody who has BPD, like he didn't exactly say this. He was kind of like a like he kind of was just like, yeah, BPD and you're having so and so symptoms, which was it was honestly mainly like revolved around like insecurity. And he's
Mhm.
like, and the only way to combat this is by going on medication. So of course you're gonna believe your doctor and you go on
Right.
medication and like everybody's different. And just like my body wasn't as like receptive to it as like other patients he's had in the past. It was very like he was very like reluctant to take me off of the medication because he was worried I that I thought I was doing bad on the medication, but that it would just get a ton worse when I got off, and then I would start to like relapse and like all like the like thoughts that I used to have. So that's why he was so worried about like I don't think we should take you off the medicine. So instead of taking me off all of my medication at once, it was like a slow progressive like 1 month I was off of Adderall because I have ADHD, and then
Mhm.
another one off of anxiety medication, off of antidepressants, off of antipsychosis medicine. It was like progressive because
It's
he
a
was
whole
worried.
process.
Yeah, he was worried that if I got off of my medicine that I was kind of tricking my mind into thinking medication was bad because like like it's just another hassle of everyday life.
Right.
Oh
Yeah.
man, I gotta set my alarm. Oh, I gotta take my medication. So that's what he originally thought it was, but I think I'd do
Would you
better
say that,
without it.
sorry, would you say that like maybe how you felt was kind of overlooked medically?
Sorry, I was drinking. Um,
Take your time. I also need some water.
um, yeah, I mean, uh, yeah, I feel like a lot of what I hold on. Sorry. Anyways, I feel like a lot of what I've said to my doctor originally was really brushed over. So, like especially after actually I think it might have gotten worse after the diagnosis because
Huh.
there's a very like specific thing that like doctors think, but then I think differently. So they kind of have to conform to like why do you think this way?
Right.
It was very like, are you sure that's how you're feeling? Because a lot of the time with like BPD, like your emotions are very like I don't know, they're very high strung. So a lot of the
Hmm.
time you make decisions without fully like processing what you're
Hmm.
making a decision on. So that I feel like that's partially why I was brushed
Right.
off a lot because they were worried that I was just like jumping to things.
Right. But that's still kind of messed up though. Like they
Yeah.
were completely just like brushing off what you were saying because they assumed that you couldn't make decisions for yourself.
Yeah.
That's kind of crazy. Not a fan of that. And you know what? I bet it partially probably is because of some of the stuff I was talking about earlier with how people with BPD don't really go into psych and don't really do research that they might innately understand better.
Yeah.
I was gonna ask also, what are your other diagnoses that you have? I know you mentioned ADHD. Do you have like, is there other stuff there?
Um, I have obviously BPD,
Right?
ADHD, and anxiety. That's it.
Okay. I was curious, like, do you see symptoms there like overlapping?
Definitely a lot with anxiety because with BPD is very much about like strong emotions.
Hmm.
So, insecurity is a really big one for not just me, but a lot of people with BPD. So anxiety kind of goes hand in hand with insecurity.
Right. And I totally also get that where I can feel like for literally no reason or for things that I'm totally overthinking, like super, super insecure in certain relationships I'm in.
Right.
And I think that is probably also because OCD is at least there's a whole thing that I'm kind of mad about where they removed OCD from the generalized anxiety disorders like category in the DSM-5, which I don't think they should have done. I think it's I mean, okay, well, I won't get into this right now. But in short, I also have an anxiety disorder, and I think that is like a big product of that.
Yeah.
Is there, yeah, okay. So I guess that's a lot of what I wanted to cover, actually. Thank you. Is there like any other stuff that you would want to mention about your personal experiences that maybe you want people to know?
Um, I don't know. I feel like I've like talked about like definitely definitely when you're talking to doctors, definitely like be pretty firm on your stance because you know
Mhm.
your body best typically.
And I think
And
that goes for everyone, yeah.
like you know how you feel. Don't let people try to tell you that you aren't feeling that.
Hmm. Is
um
there, yeah.
hmm?
Is there like any, not to be so cheesy, but is there any message that you would like to, give the world about like, how maybe, anything that you might want to say to people?
um well, a lot of people with BPD they like struggle a lot with like fear of like making connections and like actually getting close with people because like we're pretty hard to deal with. And I feel like people with BPD should be less scared to be themselves and like try to get along with people because there are people who will understand you like in the world because I mean you do.
I'm trying my best.
And I
I'm
mean
frankly, I'm getting quite passionate about the whole thing. I do kind of want to continue this as a field of study for myself, maybe, because I don't know. I think personality disorders in general are so under researched. Some of the definitions, in my opinion, are kind of outdated. They're underrepresented. I think it's important to, get this sort of thing out there.
right.
Okay, well, I mean, if that's all you have, I mean, are you good with ending off here?
Yeah,
This was great. Thank you. Thank you
of
for,
course.
being so open about stuff. I think it's super important. Thank you for, doing this with me. Very helpful for my little project.
Of course, of course.
Okay, wonderful. Okay. Bye-bye.
Bye.